So we'll first so we'll do the dissection or window dissection of the anterolateral crural region and dorsum of the foot. Okay, just so in this way, first we'll feel what the anterior border of the tibia. Okay, first I want to tell you this, someone has done this dissection but not in a typical window way. The incision is not done in a typical way, but I am telling you what is the typical way of dissection. So first you see the anterior border of the tibia. If going upward, you see there is the tibial tuberosity. Going further laterally, you can feel the neck or head of the fibula. So our incision site will be from there, from tibial tuberosity. There you go further downwards along the anterior border of the tibia till how much? There we have the lateral malleolus, there we have the medial malleolus. So more or less to the midpoint, close to that, we go over here. Okay. Now from this point to this point, the incision is going downwards to the ground, and it is reflected like that. Okay. But this is not a typical dissection. Now what about the foot? Foot, the dissection is continued from this region to more or less into the second finger, because second finger of the foot is the longest compared to the other, the axis. So again the incision is medial lateral, like that way the incision will go midpoint. From there we have the other incision like that, and the skin is reflected laterally medially after giving the incisions. So this is more or less the typical incision. So this is not, in this case we find the typical incisions. Okay. So after that we have superficial fascia with that some cutaneous nerve. See, there are some cutaneous nerves embedded in these regions. Okay. But there is the deep fascia. So this is the deep fascia. And most interesting, you see, there is the, if you more separate it, you can feel the medial surface of the tibia, and there is the anterior border of the tibia. But this is the deep fascia. The deep fascia is very tightly adhered to the anterior border and medial surface of tibia. You see, check it from the books. You see, on the medial surface of tibia, the deep fascia is tightly adhered. So it is closely adhered. And from the anterior border, I cannot separate it. The deep fascia, I cannot separate it. Okay. Now, like that way, I did the dissection and coming downwards. Now, this is the structures of the anterior region of the leg. So, what structures we see? First, closely you see, coming to the region, there is a muscle. This muscle. Okay. But this muscle is not going to the foot fingers, but rather it is going and attached, see, to the base of the first metatarsal bone, actually attached to this region. So this muscle which I am holding is the tibialis anterior region. Very good, tibialis anterior muscle. Next, lateral to tibialis anterior, we have another muscle. This is extensor hallucis longus. So how you can understand? See, it's going to the hallux or great toe, base of the hallux or great toe. So extensor hallucis longus is very easily identifiable. Lateral to that further, the next muscle you see, distal longus. See, very nicely identifiable. 4 tendons. For the lateral 4 toes, not excepting this one. Okay. So 1, 2, 3, 4 for the lateral 4 toes. Further laterally we have the next muscle. This is the peroneus tertius. This muscle is the peroneus tertius, and it is ultimately attached to the base of the fifth metatarsal. Okay, like that. Now between, this is extensor hallucis longus and longus. What we see here some structure. One nervous structure, one arterial structure. Okay, so this is the deep peroneal nerve, and this is the anterior tibial artery. Okay, in the ankle region. If you again expose it in this region between the tibialis anterior and extensor hallucis. There you can see this is the which nerve? Deep peroneal nerve, and this is the anterior tibial artery with vena comitantis. Okay, anterior tibial artery with vena comitantis. So this is the deep peroneal nerve, anterior tibial artery is going so deep, and there it is exposed like that. So there it is peroneal nerve with anterior tibial artery. Further it is going downwards beneath the tendons, and ultimately where it is coming? It is coming in this region. This is the deep peroneal with the branch of anterior tibial vessel. So this is deep peroneal nerve. Clear? Now come to the peroneal compartment. So in the peroneal compartment, what we see? In the peroneal compartment, those who are in this region, they can only see. In the peroneal compartment, we have seen one muscle like that. We also see a muscle which is next to it. This muscle. This is one muscle. This is other muscle. Okay. So this muscle is peroneus longus. This is peroneus brevis. And where we have the nerve, this is the nerve. So this nerve is the superficial peroneal nerve. Supplies the two muscles, pierces the deep fascia, become cutaneous, and the other end of this nerve is this one. Okay, so this is the superficial peroneal nerve. Okay, and this is the peroneus longus, peroneus brevis, and you see close to the lateral malleoli, both the tendons are behind the lateral malleoli. The superficial peroneus longus tendon and peroneus brevis, both the tendons are behind the lateral malleoli. The peroneus longus is superficial, the peroneus brevis is deep. Okay, like that. So these are the muscle tendons we see in the peroneal compartment, and the nerve is the superficial peroneal nerve. Correct? Now coming to the dorsum of the foot. What we see in the dorsum of the foot? I told you these are the tendons. Tendons of
Extensor digitorum longus,
peroneus tertius, extensor hallucis longus, and tibialis anterior. Now see this arch. So this is the dorsal venous arch. This continue on the medial side as a great saphenous vein on the medial side. Okay. And along with this, we'll also get a not very prominent a nervous structure in this region, that is a saphenous nerve. Okay. Here we have the deep peroneal nerve with a branch of anterior tibial artery. Okay. Now coming to the lateral side, see the dorsal venous arch is continued on the lateral side with a short saphenous vein. Further laterally you see one nerve. This is the sural nerve. Okay. So this is the sural nerve. This is the lateral extension of the dorsal venous arch as small saphenous vein. Okay, there we have the deep peroneal nerve. On the middle side we have the great saphenous vein, and also with that we get the saphenous nerve like this thing. So these are the structures we see in this region. ঠিক আছে, ছেড়ে দাও। এবার একটা জিনিস যেটা বলার কথা